Ever been strapped to a monitor and told not to worry, we're just going to do an NST? Or you've gone to your regular prenatal appointment and your doctor sent you to labor and delivery to have the NST? Well, most pregnant women have no idea what an NST is and what we are looking for. Today, I'm going to dive into NSTs, what they are, why we do them, and what they mean. And you can expect to have these towards the third trimester of your pregnancy up until delivery day. So stay tuned. Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another fabulous video for you. I am not going to take too much time and do the introductions of it all because you girls like to click out of a video really quick, and I want you to stay tuned to get the information that you need. So our objectives are, what is an NST? What are we looking for in an NST? Why you might need one? When you may need more than an NST? Your most frequently asked questions, and then we're going to put a bow on it. So let's start out with what an NST actually is. So NST stands for non-stress test, and that's exactly what it is. We put your baby on the monitor and we monitor your baby from the outside, just chilling. We just want to see what it is that your baby is doing on a regular Tuesday or any other day of the week. We want to see how your baby is responding to just life inside the womb and how it may or may not react to contractions if you are having some. It's basically like a wellness check for your baby and a little bit of a test too. So NSTs typically start around 28 weeks gestation, and you can expect to have them done in your doctor's office, or they may send you to an office where they only do NSTs, and sometimes they may send you to labor and delivery to have your NST done if they have specific concerns. So NSTs are basically a time test for your baby. The average NST will last 20 minutes. You have to have at least 20 minutes on the monitor so your nurse can interpret how your baby is doing. If the NST goes beyond 20 minutes, which sometimes may be necessary, then your doctor will usually want to look at you for a bit longer, up to about 40 minutes before they do another test called a BPP or a biophysical profile. But first, let's go ahead and talk about what we're looking for when we are getting an NST done. So an NST is basically a pass or fail test. In this case, when we're thinking about NSTs, we want to say that a pass is a reactive fetal heart tracing, and if the baby does not pass, we say that it is non-reactive. Non-reactive isn't always a bad thing. It's kind of one of those gray areas. Like if it's reactive, we can guarantee that the baby's doing pretty good. But if it's non-reactive, we're like, maybe we have to watch a little bit longer. Maybe the baby's in a sleep cycle and so on. So this is not a fetal monitoring class, but I do like to go over with my patients what I'm looking for when I am doing an NST, or when you're in labor and I'm looking at your fetal heart tracing on the monitor at the nurse's station or in the nurse's lounge or even in your room. Now, I always tell patients they don't have to do my job. I'm not telling them that they have to interpret the tracing. In fact, it's very difficult and it takes a long time to learn how to do that. But it is something I want you to understand that I am looking for so that when we have to do interventions, you understand it is for a reason. So the first thing that we are looking for when we do an NST is the baby's baseline fetal heart rate. So I like to explain to parents, when you hear your baby on the fetal monitor, it sounds like a horse galloping, literally like a horse galloping. And if that slows down, then that's when we become concerned. So for example, the adult heart rate is anywhere from 60 beats per minute to 100 beats per minute, right? And it can go higher, which could indicate different things, right? And for some people it's lower. So it really just depends. But the average normal heart rate for the average adult is anywhere from 60 beats per minute to 100 beats per minute. With a baby or a fetus, we are looking for a fetal heart rate of at the lowest 110 and at the highest 160. So if your baby's in that range, we love it, okay? And when you have an NST, that's exactly what we expect. The next thing we're looking for is the variability, right? Is the heart rate going up and down and doing some of the fancy things? I like to look, when I'm looking at the fetal heart tracing, I like to describe it as I'm looking at ocean currents. That's what it looks like. You know, like when you're in elementary school and you're drawing the water. That's what variability looks like with a fetal heart tracing. Now, the opposite of variability is absent variability, and that looks like just a flat line. But there are different levels. There's absent variability, there's minimal variability, there's moderate, which we love, and then there's marked, which is kind of like one of those things like, do we love it? Do we not? But definitely we're hoping that you have moderate variability, really easy to interpret. It's a really good indicator that your baby is doing well inside of you. Then we look for accelerations, like when we accelerate in a car, right? Get it? We're pressing on the gas. We're looking for those increases in the fetal heart rate. So I like to describe it as your baseline fetal heart rate is your baby on a swing. Your kid's on a swing, you're swinging, right? And then the acceleration is when you go high up in the air and it's like, whee, but you come back down to your baseline. So that's how I like to kind of describe a fetal heart tracing and what we're looking for. So we're looking for a normal baseline heart rate. We're looking for moderate variability, okay? And then we're also looking to see if you have accelerations. And if you have accelerations, then we usually can say that your tracing is reactive. But there's some caveats with that. And then we are making sure that you are not having any decelerations, right? Any slowing down of the fetal heart rate, which can happen sometimes for different reasons. So again, that's why you're in the office. We are making sure that everything is gravy and cool and that your baby is doing well. So why might you need an NST? There are several reasons why women get NSTs. Some of it is just the regular routine monitoring of pregnancy in the third trimester. And then there are other reasons why some of you may be more high risk, which then puts your baby at further risk, and they may want to do more frequent NSTs. So if you call me up on the phone as your doctor, as your midwife, or as a nurse who's working in triage, right? And you say, I don't feel my baby moving, or I haven't felt my baby moving since 2 o'clock and it's 8 p.m., or your baby's moving, but not as much as he or she normally moves, then we'll have you come on in and we'll do an NST. Now, for some women, they have what's called an anterior placenta, which means the placenta implants itself in the front of the stomach. So basically, you can't feel your baby moving ever. I remember having a patient one time. She would pop in on a regular basis because she couldn't feel her baby moving, but she had an anterior placenta. So as soon as I put her baby on the monitor, the ultrasound monitor, I could hear all this swimming and moving around, but she could feel none of that. And that's valid because I would rather you come in so I can make sure that your baby's doing well than for you to stay at home and kind of go back and forth in your head about it. Any of those medical problems that make you high risk, diabetes, hypertension, preeclampsia, if you're past your due date, sometimes an IVF pregnancy, if you have a multiple gestation pregnancy, like twins or triplets, if your baby is measuring smaller than we would expect for your gestational age, for example, if you're 37 weeks, but your baby is measuring 32 weeks, they might want to just continue to monitor the baby's growth. Also, if you have low amniotic fluid or you have too much amniotic fluid, or if you fall or get in a little fender bender, they will want to monitor you by way of an NST. An NST is just really great and very functional because it's not invasive. You're literally bringing your book to the hospital with you or your phone and get on your phone and play games or read your book, and you just hang out on the monitor. And so it doesn't hurt you, it doesn't hurt the baby. We're just literally Big Brother hovering and watching your baby's tracing. So the question becomes, when do you need more than the NST? A good example of that would be that you come in, the heart rate is good, right? You have moderate variability, but you're not having those accelerations. So what's going on, right? Or you have great baseline fetal heart rate, right? It's in that window that we talked about, but the variability is not really there. Then the doctors may do the test that's called a biophysical profile or a BPP, which is also non-invasive, so don't get worried about that. But it's a better determination of what direction we should move in with your pregnancy, whether that's keeping you and monitoring for a much longer time on the antepartum ward, or whether that's going ahead and delivering you right away because maybe your baby is showing signs of distress. So there are some non-medical reasons that your baby could be non-reactive. Maybe your baby's just sleeping. Maybe we caught them at the wrong time. They had a long day and they're just in there sleeping. So we do allow for that. We're not going to rush you to the operating room or start an induction because your baby is sleeping. No, we do allow for that. So sometimes we'll just need to keep you on the monitor a little longer. Or if you haven't eaten and your baby hasn't had that sugar spike that we know kids can get, right? So if you haven't eaten or had anything to drink, then maybe your baby isn't very active. So we can correct those things, right? We can hydrate you with IV fluid. We can hydrate you with a pitcher of water. We can give you juice for the glucose spikes or feed you, so there are things that we can do to get that tracing to become reactive. But in the case that is not the case, like it's a medical issue like hypertension, for example, or your baby is just showing signs of distress, then this will help your doctor determine what your next steps are. So one of the most common questions we get is, what an NST is, which I've answered for you, but we also get, will this harm my baby? And the answer is no. Again, it is just like having headphones on your belly and your baby is maybe a little salty about it, because babies do tend to like kick at the monitor or hit at the monitor, but it does not hurt them at all. Do you have to sit still when you get an NST? It would be nice. I know that's hard to do, but it would be nice, especially if you're like 28 weeks, 29, 30 weeks, your baby is smaller and they wiggle around a lot more. So the more that you shift, then we have to shift the monitor because then your baby is shifting. So keeping still would be nice if you can, but yeah. Keeping still would be great. Again, if the baby's asleep, that's fine. We respect that everybody needs a little Z's. So we'll go ahead and let you have some juice, some water, get you hydrated, give you more time on the monitor, and let your baby prove that they are in it to win it and to stay in utero. So if you go to the doctor's office and they send you in for an NST, don't be stressed out. Don't worry. We need to get the NST first, and then we can make decisions from there. It's not always a bad thing. NSTs are a proactive, non-invasive way to check the health of your baby and the status of your baby. So maybe I'll see you on labor and delivery or in the antenatal testing unit, who knows? But now you know what an NST is. If you're pregnant, lovelies, and you really want to know what actually happens in the hospital rather than the highlights and the lies that they tell you about on TikTok and Instagram, then follow me, okay? Subscribe. I have plenty more videos for you to check out. And we have these sessions because we want you to really go into the hospital knowing what to expect and not expecting things to happen any one way because someone else online said it should, okay? All right. I wish you all the best. And if you are a C-section and you want to know how you can best recover from that C-section like a champ, then check out this next video that I'm going to leave for you on the screen. Bye. Hey guys, it's Editing Rini here, and one of the things I never do is tell you all about my website. So this is it. And what you just saw was a flash to a free module that I have on my website by way of the little widget down below. You can also check out the Mommy and Bloom Academy, and we have many course options, but we do have free options as well in our First Steps tier. Then you can go onto my website and also see and learn a little bit more about me, as I am a real deal person. And this is our proven system that helps mamas like you navigate the childbirth experience. Lovelies, our goal is to make sure that you walk into the hospital informed. Having a realistic expectation and knowing the ebbs and flows of a hospital-based birth will help you navigate the process with ease.
Now where do we go from here? Tell me.